Here at West Coast General Hospital, the entire staff takes pride in providing safe patient care, developing methods to keep both the patients and staff safe. In this video, we will discuss pre-handling checks, 1-person and 2-person assists, the Sarah Steady, and mechanical lifts, covering types of slings and sling sizes. We will also discuss falling stars and other ways that we keep patients safe here on Med-Surg. All patients, while they're staying here at West Coast General Hospital, are encouraged to wear good grippy socks or good grip shoes, helping to prevent slipping and falling. Now let us begin with VHA's pre-handling check. Is your patient able to lift their hands above their head for 5 seconds? Are they able to hold both of their feet up in the air for 5 seconds? This not only giving us an idea of the patient's strength, but also their ability to follow instruction. Are they able to bridge for 5 seconds, putting their feet into the bed and lifting their buttock? And now that we have an idea of their physical strength, gently help them to the side of the bed by rolling them on their side and helping their feet to the floor. Use minimal assistance. Allow the patient to help themselves. Now that you have them sitting on the side of the bed, have them hold their hands up over their head again for 5 seconds. And then the same with their feet, having them hold their feet out in front of them for 5 seconds. Finally, have your patient reach out to touch your hand. This will give you a good idea of their core strength and their balance. This patient has demonstrated that she is safe to transfer. In accordance with the VHA policies and protocols, patients requiring transfer assistance are required to wear a transfer belt. Please take a few moments to help your patient with the equipment, teaching them the importance of lifting up from the bed or the chair and not from grabbing from the walker. Once the patient is safely standing and the caregiver has a firm grip on the transfer belt, proceed to walk. This is a 1-person assist. When the patient has demonstrated a good ability to ambulate, they will become a standby assist. Patients at West Coast General Hospital are encouraged to walk at least 3 times a day. If you are having a problem ambulating a patient here at West Coast General Hospital, please refer it to our physiotherapy department. It might mean the patient needs to be deemed a 2-person assist. Physiotherapy will update both the whiteboards and the worksheets with the latest transfer statuses on a patient. Here's an example of a 2-person assist. If you ever have the unfortunate incident of a patient falling down on you, do not hold them up. Gently guide them down with your knee to the floor and immediately call out for assistance. And make sure afterwards you go onto the BCPSLS to record the fall. And if you, the handler, are injured in the fall, make sure you take the time to report the incident to the Workplace Health Call Center, and then notify your clinical coordinator and get medical attention at the emergency room. Also, make sure that a yellow fall sticker is placed in the Cardex. On the chart, a note is made in the physician's notes, the hit list, and also a yellow sticker is placed above the bed next to the patient's name, letting all staff know that the patient is a fall risk. Finally, put a falling star on the patient's whiteboard with the date and the time of the fall. This will help staff members develop any sort of patterns that might be happening with the patient. Be sure to develop toileting routines for your high-risk patients. Plus, make sure water, Kleenex, and their call bell are always in reach. For your patients that have lost the ability to walk but still have the ability to stand, the Sarah Steady is a great option for transferring patients from the bed to the chair, from the bed to the bathroom, or for showering the patient. Simply place the patient's feet on the platform of the Sarah Steady. Next, before the patient stands up, make sure both the brakes are firmly set. Next, firmly grabbing the transfer belt, have your patient reach out for the blue bar in front, grabbing with both hands and standing to their feet. Next, flip down the 2 blue paddles behind the patient, forming a bench for them to sit onto. Here is a second angle. Both hands firmly on the blue bar, standing up, and then the blue paddles down behind the patient, forming a bench. Your patient is now safe to transfer to a chair, to the bathroom, or for a shower. West Coast General Hospital Med-Surg department has 4 Serostetties, keeping both patients and staff safe. The Serosteti has a weight capacity of over 350 pounds. For the patients that are unable to mobilize, West Coast General Hospital also has mechanical ceiling lifts in all the patients' rooms. Here, Haley will demonstrate with a universal sling just how easy it is to get a patient from the bed up into the wheelchair. First of all, ask your patient to roll onto their side. Then take the blue sling and line it up with the yellow strap right along the spinal cord. Next, have them roll over toward the handler and pull the sling through. Next, take the 2 long straps along the legs and loop them through the middle. So they now are on the inner part of the leg. Next, with the remote control, position the carry bar directly above the patient, attaching all the straps to the carry bar. Finally, press the up button on the remote control and gently lift the patient off the bed. Be sure to be watching out for Foley catheters and any other objects that might be attached to the patient. Be sure to get a second nurse or caregiver if the patient has too many obstacles to bring across during the lift, or if they're purple dotted. The slings at West Coast General Hospital Med-Surg department are kept off the room in 2718, stocking 4 different types of slings, including positioning slings, hammock slings, universal slings, and hygiene slings. 4 different sizes are available and are all based on weight. Take your time to familiarize yourself with the sling room and understand the different sizes and types of slings that we have available. When removing a sling from the sling room, make sure it is clearly labeled with the patient's name, avoiding any cross-contamination in a shared bedroom. And when the patient is finished using the sling, make sure it is placed in the linen bin across from the soiled utility and not in the blue and gray bins. Slings, panels, socks, and transfer belts are all washed in our in-house laundry system. Thank you for taking the time to watch this safe patient handling video, keeping both the patients and staff safe at West Coast General Hospital. And stay tuned for future safe patient handling videos coming very soon.